To get a better understanding of what may be causing your back or neck pain, we are going to review the basic anatomy and physiology of the spine. We will begin by examining a healthy spine and learn how certain activities or traumatic injury can lead to lower back pain that may radiate down the legs, or neck pain that can cause numbness or tingling in the arms and hands. Once we have identified the most common causes and conditions leading to back and neck pain, you will learn how spine med decompression therapy is designed to alleviate the underlying problems, relieving pain, and helping you return to the activities you enjoy, all without the use of drugs or surgery. The human spine is made up of a series of bones, called vertebrae, connected together by ligaments and muscles. The spine is designed to protect the spinal cord, the superhighway that carries electrical signals from the brain to the rest of the body. Each vertebra in the spine is separated by an intervertebral disc. For simplicity's sake, the disc can be likened to a jelly donut. It has a soft gel-like substance in the center called the nucleus pulposus, which is surrounded by a tough outer coating called the annulus fibrosus. The discs serve three primary functions. They act as shock absorbers to prevent compression fractures of the vertebrae. They provide mobility to the spine, allowing it to bend and twist. And they separate the vertebrae, allowing nerve roots to branch off from the spinal cord and travel to the rest of the body. Let's take a closer look at a healthy intervertebral disc, this time looking down on it from above. The pink portion represents the nucleus. This is the gel-like center of the disc responsible for healthy disc height. Water is held within the nucleus by tiny sponge-like molecules called proteoglycan aggregans. These super sponges have an amazing ability to attract and hold over 500 times their own mass in water. The nucleus is surrounded by the annulus fibrosus. Like the term fibrosis implies, the annulus is a tough, fibrous material made primarily of type 1 collagen. Its primary job is to keep the nucleus contained in the center of the disc. In a healthy disc, the annulus is very pliable and capable of bending and flexing. Notice that the annulus has its own nerve supply, shown by the yellow dots along the outer wall. The spinal nerve roots, seen here in yellow, are extensions of the brain and spinal cord. The facet joints are located just behind the spinal nerve roots. It is at these joints that the vertebrae make contact as they are stacked upon one another. The disc relies on the transfer of fluids and nutrients from the vertebrae above and below, as well as the outer layer of the annulus to stay healthy. Excessive loads on the discs result in increased pressure that slows the transfer of these vital fluids and nutrients. Continued wear and tear results in dehydration and disc degeneration. Excessive weight, poor posture, heavy lifting, or repetitive movements may accelerate this process. The most common feature of disc degeneration is the loss of fluid in the disc nucleus. As the discs shrink, the space between the vertebrae decreases, causing more bone-on-bone activity at the facet joint. This may cause pain and irritation, known as facet syndrome. Furthermore, disc dehydration causes the tough, pliable outer coating of the disc to become brittle and susceptible to cracks and tears that may lead to disc herniations. As we learned earlier, this outer layer of the disc has its own nerve supply. Small cracks or tears in the annulus alone may cause severe low back pain. As the tears worsen, the gel-like material of the nucleus begins to push through the annular wall, creating a disc bulge. As the condition progresses, the bulge applies a physical pressure to the nerve root. A compressed nerve often causes lower back pain and sciatica, a pain that radiates into the buttocks or down one or both legs. Damaged intervertebral discs seldom heal because they remain under constant pressure, even when a person is at rest. With back and neck pain reaching epidemic proportions in this country, medical professionals recently began exploring additional treatment options. By combining science and technology, one of the world's most advanced conservative treatments for disc injuries was introduced with the SpineMed decompression table. SpineMed decompression therapy is a non-surgical, drug-free treatment that has been clinically shown to help reduce the disabling pain associated with bulging discs, herniated discs, disc degeneration, facet syndrome, and sciatica. The SpineMed decompression table acts to isolate and decompress spinal discs through distraction and positioning of the lumbar or cervical spine. This procedure takes place with the patient fully clothed and has been described as safe, painless, and extremely effective. Through precise computer controls, the SpineMed is designed to target the damaged lumbar or cervical discs and then gently distract the spine. Under distraction, the pressure exerted on the disc is reduced dramatically, which may help draw the bulging or herniated gel-like material of the nucleus back into the center of the disc, relieving pressure on the nerves. Furthermore, reduced pressure helps the disc draw in the fluids and nutrients necessary for proper hydration and disc height. Following a care plan of approximately 20 SpineMed treatments, patients may realize a cumulative effect that significantly reduces lower back or neck pain, and all without the use of drugs or surgery.